Hey y'all, welcome to the Team LoCoFit Roundtable, hosted by me, Lauren Conlon, owner of Team LoCoFit. Each week, I am joined by one of our coaches to dive headfirst into the nutrition, training, mindset, and coaching strategies we use with our clients. If you loved the show, please subscribe, leave us a review, tell a friend, you know the drill. And for more information about coaching, the programs we offer, and additional content, visit teamlocofit.com. All right, and we are back, and I'm joined once again with Racquel, the queen of skincare. So if you guys did not listen to our first episode that came out on Monday, it was all about skincare for fitness enthusiasts and gym goers and stuff, so highly recommend checking that out. And we also wanted to make a podcast covering everything injectable related. So think Botox, Juvéderm, fillers, like all of that, and even stuff like PRP and just kind of more medical grade, like advanced, treatments. So yeah. There's so many questions about injectables and there's so much bad information. And, I definitely think, like we talked about in the first podcast, like skincare and like aesthetics and stuff in general has come so far. Like when you first started, even like 10 years ago, it was like this very taboo thing. And, people still nowadays think like, oh, you got your lips done, like you're going to look like a duck. And you're like, no, that was like somebody who did a really bad job and needs like 4 syringes. Like it's not, if you're going to people, it's just like plastic surgery. Like there's plenty of girls who go in and they want very overdone, breast augmentations, right? But most people are going in and getting very normal enhancements. You know what I mean? Like I have implants, but they're not like over the top. You're not like, oh my gosh, like it's just, you have to do it like in a tasteful way. And injectables has come very far, I would say. But there's still plenty of room to learn and improve.
Yeah, no, I couldn't agree more. And that's one of the first things I tell my patients when they come in for their first consultation with me, because the first time people are very nervous, and I hear a lot either from the patient that they're very nervous, or I always hear my husband is freaking out that I'm getting my lips done, my boyfriend is freaking out, And so I always try to talk them off the ledge, and I'm like, here's the deal. First of all, when you're looking at your provider or you're seeking out your provider, find someone whose aesthetic aligns with yours. Like my aesthetic philosophy is a very natural approach. I like a very natural look. I feel like you should look like yourself, but just your best version of you. You want to just look relaxed, refreshed, more youthful, not different. So 99% of the patients that come to see me are not there to look weird. They don't want to look injected, plastic, fake, all of those things that they'll say they don't want to look. We know that, and so I don't want to look weird either. So, and I tell people, look at your injector when you walk in the room. If she or he looks freaky, you should leave, because you're going to end up looking freaky, because that is what they're in their head is their norm, So my approach is definitely more natural. I like to just give people very natural enhancements, enhance what your mama gave you, and then sometimes it is just you deficit, like whether it's predisposed, like if you were born, with super hollow under eyes, or lifestyle, like if you're a big workout person and you're super, super lean and you have no fat in your face, we can give you some volume back, or maybe give you volume in places that you just weren't gifted with that. But at the end of the day, when you've had a treatment done and you're walking down the street, no one should be able to look at you and be like, okay, she had her lips done, her eyes, like, you shouldn't be able to tell. It should just be like, wow, she looks beautiful. What is it? Is it her hair? Did she get a good night's rest? So if you can sit there and pick somebody apart, or if somebody walks down the street and you saw their lips before you saw the rest of their face, then they either had, it was poor technique, poor judgment by the injector, or the patient. Sometimes we do see where they, people have BDD, or they want this crazy aesthetic look. And I won't do that, but you can guarantee that somebody will keep going door to door to door till somebody will do what they want. And unfortunately, sometimes it might not be in the patient's best interest. But no, you can absolutely do injectables as a nice preventative treatment to age gracefully, to age beautifully, and look totally beautiful and natural. And, my goal is just to help people understand they don't have to be afraid, so.
Yeah. And the stuff, which we'll get to, but it does dissolve. So even if it is like, even if something happens and you go somewhere and you don't like the results, you can always either naturally it will dissolve or you can get it taken out. So that's a positive too. So first and foremost, when somebody is looking for a practitioner, what are just some credentials that we should be looking for? And I don't know if there's like a standard pricing people should be aware of. Obviously, typically I know like, hey, this much per unit is typically what a good person will run. Basically, I just want people to know, okay,
I should go look for somebody with these credentials around this price tag. You know, you don't want to be going on like Groupon and like getting deals and like going to like a party and getting this done. Like, you know, people do this.
Like, no, actually, it's so funny you bring this up because I actually had a doctor's appointment this morning, just like a physical, just a checkup. And the MA who was rooming me was like, oh, the girls out there said you do Botox and filler and stuff. And she's like, I didn't know nurse practitioners did that. And I was like, oh yeah, it's a whole thing. You know, a lot of people just don't know. And then she's like, yeah, one of our other patients, she just started doing it too, but she just took like a weekend class and she doesn't even have a medical degree. And she told me to go to the class. And I was like, wait, she's doing Botox and she doesn't have a medical degree at all. Like she's not a nurse or a nurse practitioner or a doctor. She's like, no, she's just like a stay-at-home mom and she's just like bored and wanted to do something. And she took this class and now she's been doing Botox at her house. And I'm like, okay, first of all, that's highly illegal. Second of all, you know, in the state of Missouri and most states out there, you have to be a medical professional. You have to have your RN license and up to inject. There's a lot of estheticians out there that I'll see injecting that are unlicensed in the medical world. It's not the same thing. They should not be doing injectables. People have to understand that this stuff is a medical procedure. So it's fun and it's light and it's fun to talk about, but Botox and fillers are a medical procedure and people need real medical background and training when they're doing it. Facial anatomy there's so much to it and it's so much more complex than one would think when you're doing an injection on somebody. Like injecting one wrong muscle can leave somebody with a droopy eye or, you know, there's real things to look into. So I think it's so important that when you are looking for a provider that you do your homework. Instagram is such a great tool nowadays because you can really look and see, and it's not about, don't look at like how many followers they have or how cool they are. Look at their work. Like, you know, what do the before and afters look great? You know, there's a website called realself.com. You can get on there. It's a forum for the aesthetic community. And you can get on there and search providers in your area and read reviews and things like that and see how they look on there. And then honestly, word of mouth is just like the biggest thing. So in your hometown, if you can kind of ask around and see who are the bigger names, like if they're aligned with a plastic surgeon, that's always a good sign. Not that like solo med spas are great too. It's just, you know, make sure that it's not somebody who, make sure their intentions are good. The thing with this industry is it's getting super saturated. There's med spas popping up on every single corner. And unfortunately, a lot of people just want your money. And so they'll do whatever they want. They'll give you whatever you want just to take your money. So you have to make sure that you've got somebody who is a true professional who will tell you no if it's not something you need or redirect you, you know, things like that. So I would say, you know, just looking for obviously credentials, making sure they're qualified, that they have a good reputation. And then when it comes to cost, absolutely, like we were talking about this with skincare. You pay for what you get. I'm saying it again, but it's true. Like if you're seeking out a really well-experienced provider, somebody who's been in the field for a long time, who has invested in their self and their brand and their education, this field is ever evolving. So as a provider, like we are constantly doing continuing education. We're attending conferences and seminars and we're reading articles and we're going to trainings like every week. There's something, you know, like there's a webinar that I'm hopping on tonight. So if you're seeing somebody who is, you know, keeping up with their practice and their skill set, who has lots of experience, who, you know, is a reputable provider, you're going to pay more than somebody who's just doing it for fun, you know? So keep that in mind, that I would say you're not paying for a syringe of filler or a unit of Botox. You're paying for the hand and the skill set that's injecting it. So, you know, if you're seeking somebody out who is supposed to be the best of the best, they're gonna be a little bit more expensive. But on average, it's really gonna depend on where you live and things like that. But filler is gonna typically nowadays run anywhere from like $600-$700 and up. And then Botox per syringe, yep. And then, but filler lasts. The thing to know about filler is it lasts like 1 to 2+ years. So you're paying a little bit more upfront, but it's not something you're doing every few months, more like an annual thing. And then with Botox, anywhere from like 12, 13, 14 and up a unit is probably like industry standard at this point. So it will vary depending on where you live. If it's a small town, big town, you know, things like that.
Yeah, those are really important things for people to understand, because that is something where, you know, you want to go in, you want to look, like you said, just like a better version of you. You don't want to look different. You don't want to look scary. Yeah. But you will, if you go to this party with this chick who just like took an online course, who knows nothing about facial anatomy, and now you have one crazy eyebrow and your lip filler is like up to your nose. And
exactly.
It doesn't, like, obviously things happen even with people who are extremely, like, really qualified, but generally speaking, it's going to happen much less reversible types things,
Yeah. And I think the biggest thing with that too is like, I mean, I have complications. I'm not perfect. And I always say it's not if, it's when, because I do such a high volume of injectables. It's just not if the complication's coming, it's when. But the thing is, when you see somebody experience, they know how to handle that. So my patients know that if they have a complication in my chair, like I know what I'm doing, I know how to handle the complication, whether it's filler related, we're going to reverse that filler. This is something to check if you're, seeing somebody for the first time. You always want to make sure that the filler that they're using is an HA filler, hyaluronic acid, and that it is reversible and that they have the antidote on hand. You always want to make sure the office has hyaluronidase, and that's the enzyme that can dissolve filler, because the worst thing that can happen when you get filler is a vascular occlusion, and that's if a little bit of filler makes it into a vessel. And again, a well-trained injector knows how to avoid those vessels, knows how to stay away from danger zones. But complications can happen. And if it does happen, it's not the end of the world if it's treated right away. We immediately dissolve that filler, we get it out of there, and we stop the complication before something bad happens. But if the person doesn't have the antidote, then what can happen, it can be really catastrophic. The tissue could necrose, you could lose tissue. I mean, there can be some really heavy things that can happen bad with filler that people just need to realize. So it is important to treat this like a medical procedure, make sure that somebody has all the tools and, the skill set to take care of them should they need something. And also just from a customer service standpoint, like you said, like if, somebody came back and they weren't in love with their lips, like we're going to do whatever it takes to make them love it, so it's just like someone who will be there. Whereas you go to a Botox party and you have a bad result, you call that person, they probably won't even answer their phone. Like, where does that person even live? How do you find them? Like I've seen so many Botox parties gone wrong. I can't even tell you, like I can't.
You couldn't pay me to go do that. Like, you know what I mean? Like, unless it was like you had a party with like 4 people that I knew, like, you know what I'm saying? Like, but you wouldn't even do that. It is such a strange thing that people would want to do, but people love a discount. I mean, this is just through and through with everything. And it's so funny, like, as you're saying all this stuff about like practitioner and like, continuing education and like price and all this stuff. And I'm like, this is literally the coaching, and it's every industry, right? Like, but I always look at that for like coaching, like, okay, somebody actually educated. Do they have experience? What do their other clients look like?
Yes.
Do they do continuing education? Like, are they the cheapest person? Like, you don't
want the cheapest person. And also I always say, do not group on your face. Like there are things you can group on these headphones, group on this cell phone cover. Do not group on your face. Like, no.
Especially with something with a needle. So to get into kind of a few of the basics. So everybody hears about Botox. Everybody like, that's, I would say, probably like the most name brand one. I actually like Dysport better.
Yeah.
But let's just kind of go over some of the Botox basics. Like, where would you put it? Like, how long does it last? Kind of all that.
Yeah. So, okay, there's Botox, Dysport, Jeuveau, and Xeomin. There's 4 neuromodulators on the market right now, about to be a 5th. They're all type A. So they're very similar in the way they act on the body with some very slight variations. So they're all great. I actually use all of them. Botox tends to be the one that people hear talk about the most. They had the patent for the first 10 years. So people just know about it more. I always describe it like Kleenex, like, hey, hand me that Kleenex, even though it's probably not a Kleenex, So Botox has just become a household name. But what it is a neuromodulator relaxes muscles. So I always explain to people, Botox has been used in the human body for years. There's a lot of therapeutic uses for Botox. And these are things like migraines, bladder, prostate, neuromuscular disorders. It's used in kids, adults, in really high doses. So it's really safe. It's a safe drug. We know a lot about it. It's been used and studied forever. When we're using it for cosmetic reasons, we're just using smaller doses, and we're using it in the muscles of the face to relax those too. So I usually explain that to people just to try to ease their fear, because some people are still scared of the word Botox and they think it's something bad or scary, but it's actually very safe. It's, if you really want to break it down, it's safer than Tylenol, the way that it acts on your body. You can overdose on Tylenol. Tylenol can hurt your liver. Botox cannot do those things. So, I mean, technically, I guess you could OD on Botox, but it'd be really hard to do. So with Botox, what we're using it for in cosmetic medicine most commonly usually the starter area, I call it the gateway drug, is just kind of a little Botox like in the forehead. And so we're using Botox to treat expression lines. So expression lines are caused by muscular motion, and it's like the frowning over time, raising of your eyebrows, squinting really hard. Those muscles are constantly contracting and the skin pulls with it. So it's just like if you had an accordion moving or a piece of paper folding over and over again. Once you've frowned so many times, that wrinkle starts to just kind of stick and stay. And so we call that a static line. So if you are rested and you're not moving your face and you're just sitting really still and you can see lines there when you're not moving, you're starting to get static lines, and that's a great time to begin Botox. So Botox is going to prevent those lines from getting worse, but it will also treat them and get rid of them. So younger is better. And if you look at our industry, the millennial generation is actually the fastest growing population who is, using Botox because we're more educated and people know more about it. But I also say it's never too late to start either. So for the woman who is 50 and just realized like, hey, I want to start working, it's never too late, so we can always get improvement. But what we want to do with Botox is just relax the muscle. And so we're not hurting anything. We're just causing the muscle to relax a little bit. So when you frown, it's not scrunching quite so hard. And when you can't scrunch as hard, the skin no longer folds, it gets to lay flat, and then the little line just falls away. So Botox takes about 2 weeks to kick in after you get it injected. And then at 2 weeks, you'll just notice right away that the skin instantly looks smoother. Those lines are already fading away. It's like an instant pick-me-up. There's actually so many studies now linking Botox to depression too. Just a little plug when you said pick me up, because people feel better when you get Botox. And I swear it's just one of the many little things you can do that when you just wake up and you look in the mirror and everything's just a little tighter and smoother and lifted, you're just like, oh, I feel so much better. It's just like it's a little pick me up. But
especially when you wear makeup.
Yeah.
I know for me, so I have a super expressive face. Everybody knows that. If you know me, follow me. Like anytime you see a picture of me or like pause a video, I'm doing something with my face. And I just started noticing, like, as soon as I hit 25, like I just started noticing, like, started getting the lines, started getting all this stuff. And, I waited a little bit afterwards to start getting it. But just in general, like, you start noticing, like, okay, if I do wear makeup, like it's sitting in there, or and you're just like, or you just don't like how you look as much. And the thing with Botox, and I think people hear this, and like you said, a lot of people are getting more educated now. They think like, oh my gosh, it's this whole crazy thing. Like you start doing it, you're going to get so much. And it's like, no, you can get just like a little bit. And if you do start younger, you don't need to get as much as somebody who is older. And then, hopefully you could prevent needing to have, like, if you really wanted to get a brow lift or a face lift or an eye, whatever it might be, which that's still fine if you decide to do that also. But this is a really great option to hopefully avoid some of those things.
Absolutely.
And it really, like, it does fade. Obviously it does dissolve. And what would you say that most people's, like, the span of time?
Typically, Botox lasts 3 to 4 months. So the first few times you get it, you'll probably be ready closer to 3 months because your muscle is still really strong. But once you've been in the routine and the habit of doing it, you'll find that once you get in kind of more of a maintenance mode, you don't need it quite as often. So you could go 4+ months. And I tell all of my younger girls, like, even if you did this twice a year, that's better than nothing, So just starting with, like Lauren said, like little preventative bits. You don't need to do a ton, just a little bit can just definitely help you age more gracefully. And absolutely, you'll be in a much better spot than the woman coming in her 40s and 50s for the first time. They're going to require a lot more. It's going to cost them more. So little bits starting early is definitely the best practice for preventative. So it lasts like 3 to 4 months. And then it is something that you want to keep doing, as much as you can. But with that being said, if you stop doing it, I guess ask this a lot with both Botox and filler. If you stop doing it, nothing bad happens. You just slowly will return to baseline. So, and then on the other side of that, like if you are religious with it, like I always give my example, I've been getting Botox for the entire 12 years I've been injecting. I started in my 20s. And when I had my babies, I had 2 pregnancies back to back, and you can't get Botox while pregnant. So it was almost 2 years where I really wasn't able to get Botox, but having done Botox for like 10 years straight, my line still had not returned completely to baseline, even with that long of a break, just because my skin was in such a good spot. So you'll find that even if you need to take a break for whatever reason, like if you are, maintenance mode, religious with it, it'll still hold really well. It's not like it wears off in 3 months and every little thing is gone, so.
Yeah, I got that question a lot too. Like, what happens afterwards? And it's just kind of like nothing happens. It just kind of goes back to where it was. But to your point, I have noticed that the first time I got it versus like now the last time I got it is significantly different. You know what I mean?
Yeah.
And sometimes you don't even need as much. You might need a little bit more, just kind of depending, but it just
Right.
usually holds a little bit longer. And I've just seen it works so much better. So yeah, figure out whatever works for you as far, like I said, Botox.
Yeah, there's other little ancillary areas too. Like, people always think of like between the brow, forehead, and around the eyes, but there's some other really cool things we can do with Botox too. Couple I'll mention, a gummy smile. If you're somebody who has like a super gummy smile, and most people notice it when there's like candid smile or laughing and it bothers them, a little bit of Botox in the muscle called the L-sand can just lower the smile a touch to hide a gummy smile. We can use it in the chin. If somebody has a super wrinkly or dimply chin, we call it like orange peel. It just can relax the chin. I can use it in the masseter muscles, the jaw muscle, for people who have excessive clenching, grinding, TMJ, just to relax those a little bit. Helps reduce like headaches and also helps slim the jawline a touch. The little bunny lines on the nose, if people are getting, some people see deeper lines on their nose. So there's other places we can use it too. So
yeah, it's my favorite, and it's really not that expensive to where like like I said, and if you find somebody who's good and you want to get it and you do it a few times, there's a lot less of a risk in my opinion. Like it's not really going to move as much. Like filler, I feel like has a little bit more possibilities for changes, right? Like it could move, but you really need to have somebody like particularly for, in my opinion, lips.
Yes.
Highly particular about that, which I want to go to next. So lip filler 101, like I think this is probably the one that gets the worst like rep, or like when people think about injectables, they're like, oh God, like look at that girl. Like you said, like you see somebody's lips before you see them. And like, that's not what you want. Now, if that's what you want, that's fine. If that's the look that you are desiring, go for it. But most people aren't trying to do that. But then what ends up happening is they have somebody who's not skilled, that can happen. So what are some basics? Like, when you first start, like, do you need one syringe? Do you need multiple? Like, half? Like, what kind of, all about that?
I would say it's going to totally depend on the patient. And the thing with lips is it's a super technical area. And I was just having coffee with one of my reps that sells one of the lines of filler. And they were talking about some things. And I was telling them the thing with lips is that I think every new injector, everybody that gets their hands on injecting filler, the first thing they want to do is start injecting lips, when really that's probably the last area they should start injecting. It's so technical. It really depends and varies person to person. Your natural anatomy and your natural lip shape matters so much. And then also the rheology of the gel you're going to use. So there's a lot of different fillers on the market, and the rheology of them, the way that they're made, the way that the hyaluronic acid is formed, matters. So one person's lips will do really well with one type of filler, but maybe not another. And that can totally vary person to person. So again, this all goes back to experience. It's not a cookie cutter thing. It's all about like being able to look at the patient and see like, okay, they've got a really M-shaped lip. We really need to roll the sides out. We need a sturdier filler. This would be a good choice for Restylane. Whereas, okay, this person just wants a little volume, want nice, soft and fluffy. Let's use a little Juvéderm. It just depends really on the person. And so one thing that I think is important to keep in mind is go to someone good and let them tell you what you need. A lot of times patients come in and they're like, oh, I'm here today. I want one Juvéderm here and I want this here. And it's like, that might not be what's best for you. So let them guide you, because that does matter. Usually I say you always want to start slow. Even if your end result with lip filler is you want like bigger, more voluminous lips, you have to start slow with filler, meaning like one syringe per visit. I would never put more than one in one single visit. It won't look good over time. You need slow layering of filler over time, gives you the best end result. So when I see a patient for the first time, I'll do anywhere from like a half syringe up to a full syringe. And again, that really just depends on the patient's anatomy and goals. So if you're somebody with a super thin lip and you want to go a little more conservative, I recommend like a half syringe your first time. And then if you want more of a full lip, one syringe is not a ton of filler. 5 syringes fit in 1 little teaspoon. So when you're talking about 1 syringe, it's 1/5 of a teaspoon. So it's not too much, but it also depends on the person's attitude and their mentality. Like if the patient's really, really, really nervous and they're going to freak out with swelling, I would say just do a little bit the first time. The more you do in one visit, the more you will swell and bruise and things like that too. So that's something I go through with every patient. About the healing process with lips. Lips are definitely one of the more sensitive areas on the face, and they also get the most inflamed. So when you get lip filler for like, remember when we filled yours for like right before we went to a party or something?
So
I thought
it was right before the banquet. So I came in early. So that we have a first one was a like black tie event banquet every year. So that was on a Saturday. So I flew up early. I was like, hey, I want to come see you. So I came up early and you were like, do you want to do this? And I was like, sure, let's do it. And I was like, am I going to look crazy on Saturday?
it won't be that bad.
And you're like, it won't be that bad. I was like, all right. And it actually, like by Saturday, it was, I mean, they were still obviously full, but it was perfect. And I was wearing like a darker lipstick. So even if it had bruise, it wouldn't have mattered. But literally by that night, because I was just literally busy all day. Like I went and saw you in the morning, and this was an HQ, so like I went and saw it, like we were just running around all day. And then I just went out to dinner. And by the time dinner came, I had used no ice pack. I had done nothing that I was supposed to do. Like literally it was so swollen. And I remember sending you a picture. You're like, how's it doing? And I was like, because it was mostly like the upper one too that looked really swollen. So like I remember I ordered a beer and I was literally drinking it like with a straw because I didn't want it to like like fall out. So like it can be a little much, but again it was still not ridiculous. Like I didn't look like an insane person. I just looked like, yeah, I probably don't want to look like this like on Saturday, but literally by then it was totally perfect. And I never bruised. Personally, I know some people obviously bruise a lot worse than others. I bruise all over my body with like my training. So like I figured, oh, I'm going to be a bruiser, but I wasn't.
Yeah. And you can bruise sometimes and not others. And I always tell patients, like, don't plan your lip filler like the week of anything major in your life, like your wedding or, you know, whatever, if you like absolutely would not want to be bruised or swollen during that event, give yourself a good 2 weeks just to let everything heal. I say with all fillers, it looks good immediately. You do get instant gratification and it looks great at about 2 weeks. And the reason for that is filler is made with hyaluronic acid, and that is a naturally occurring carbohydrate in the body, and it's very hydrophilic. So it's going to pull water inside of the filler as it's settling, and it'll get softer and smoother and begin to integrate with the tissue. So after you get your filler, it's normal. It's going to feel kind of stiff and hard and a little sore for a few days. And then slowly over the first 2 weeks, it's just going to continue to soften and settle. So by 2 weeks, it's so soft and smooth. You don't even know it's there. It looks really nice. I make all my patients wait a full 2 weeks before I would like do any kind of touch-ups or tweaks or anything, because during those first 2 weeks, you can totally still have a little swelling. Everything just needs to kind of settle first. And then you can kind of judge your result and be like, okay, now do we need to do an adjustment or whatnot? But typically lip filler, no matter what kind you use, I usually say it lasts about a year, just because lips are more of a high traffic area versus like eyes or something like that, because you're talking, you're chewing, you know, you just use your lips a lot. So I typically see it metabolize over the course of a year. But even in a year, it's not gone. It's not like every drop is out of there. It's just like, okay, I might want to kind of top them off a little bit or add a little bit of definition or volume. And so, yeah, so when you get your lip filler, just be prepared. I usually say 2 or 3 days. I tell patients this: the next day you're going to wake up, you're going to look in the mirror and you're going to freak out for a little bit and be like, I don't know, they're kind of big. Maybe we did too much. I'm so nervous. Like, I don't know. Should I text Racquel? And then like day 3, 4, you're like, okay, they're looking good. And then by day 5, 6, 7, they're like looking awesome, whatever. By 2 weeks, you're like, oh, I should have done more. I knew I should have done more. You know, like totally every time, stages of healing.
Yeah.
So
literally that's exactly how it goes. So something that I don't really have as much experience with because I've never actually done it, but under eye and cheek fillers. So obviously you're going to use the same types of products, maybe different from lips to all those areas. Yeah. But I know typically if people have kind of bags or hollow eyes, you would use under eye filler, right?
Yeah. 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 And I see that a lot actually in the fitness space too. This is where I see a lot of, I treat a lot of athletes actually with filler. And that's just because people who are in great shape and are super lean and fit, the one downside of your body being all skinny is in your face gets a little skinny too. And you lose some of that good fat. And so that's why if you see somebody who has a little bit more weight on them, their face is nice and full, they're not going to need as much filler. So my runners are always super gaunt. But filler will replace volume. So think of revolumization. So whether you were born that way and or it got worse from working out and just losing weight and being lean, we lose fat pads in our face just naturally. So again, like starting in the 20s, we have fat pads in our cheeks here, and those fat pads atrophy and thin out as we age. And so combine that with working out a lot and losing extra fat, and you can just get really sunken in. And when you lose good fat in the face, you start to notice laxity. So if there's not as much tissue kind of filling up the cheeks and holding everything up, these kind of empty out and everything just starts falling. You start to feel a little looser and heavier down here. Your folds might start to feel deeper just because they're hanging a little, it's a little heavier. And then your under eyes can start to look a little more hollow than they were before. And I noticed for me, like after I had babies, my under eyes got a little more hollow too, just from like weight change. And so I did a little filler under my eyes after my twins were born. But filler can replace that volume. And so we use it in the mid face, the eye, and the cheek just to kind of lift the face back up. And so for me, I have a tiny little bit of filler in the back of my cheeks. I use Voluma, and then a tiny little bit of Restylane under my eyes. And just those like tiny little subtle tweaks just to kind of catch aging as it's happening. So a little filler in the cheeks will kind of tack and lift the cheeks up a little bit, and then also give you good contour. So just like when you put on a highlighter with makeup, it's all about lights and shadows. It's what we call the OG curve of the cheek. It's where it kind of goes in at the temple, comes out at the cheek, and goes in again. That's the aesthetically pleasing cheekbone. And so we can give you just a little bit of that with filler. So it's very slimming. And so for me, I have a really round face, and people always often ask, like, if I get cheek filler, is that going to make me look like fatter or more round? And it's like, believe it or not, it's the complete opposite. It's super slimming. Giving yourself that contour and that lift in the cheek, it totally contours the face and lifts you up. So like 10, 12 years ago when patients would come in, first place everybody would fill the nasolabial folds. And now we hardly ever even fill those anymore unless they're really deep. And we more so fill the cheek to lift up, because that's what you really need to lift the cheeks back up. And then the under eye is really awesome. It's just like, if you're somebody who naturally has that sunken under eye, or again, it's getting worse with age or getting more lean, it can just make you feel or look kind of tired. And so I hear a lot when patients come in and they're like, oh my gosh, people keep asking me, are you tired? And I'm like, I'm not tired. And then you're like, thanks a lot. Like, I guess I look like shit, And so it's like, it just can refresh your under eye area. So, your eyes are everything. And I feel like you look at people's eyes when you're talking. It's such a focal point. And so it can really be like, it can really hurt your self-confidence if you feel like you're looking tired, and almost makes you feel tired. So, and also in photos, a lot of times if you're hollow or sunk in here, it'll just kind of shadow more in pictures. And I'll get a lot of women who are like, oh, can I use an eye cream or something like that? And it's like, hey, eye cream is great for your skin texture, but it's not going to do anything for volume. So if you actually have emptiness in your eyes, the only thing that's going to fix that is filler, or of course surgery later down the road. But filler just goes in and it's going to fill in that empty little valley and kind of pop that tissue up, and then just fill in the hollow spot, and just instant rest. Like, you just look refreshed, rested. Filler in the eye usually lasts like up to 2 years. It lasts a lot longer. You don't have to do it very often. I use a cannula technique. So a cannula, it's like a little straw. I make one little poke in the cheek with a needle, and that's an insertion site. And then I go up and just like lay the filler down with like this little straw right up there by the eye. So it's super safe, and it's also very comfortable. I put videos up of it, and it looks like so much worse than it is.
It looks horrifying.
Yeah. Every patient's like, oh my gosh, after they get it done, they're like, that was so easy. I was so scared. And I'm like, yeah, it looks bad, but it's not bad at all. It's very comfortable.
Like, even when you see, I mean, and not like it is comfortable, and you will do the numbing for the lips. So it's not too bad, but it's still not like great. But if you watch it, it looks
Yes.
Because, you know, you're kind of like moving it and it's like, oh my
Yeah.
God, like it's just like going in and out. But, you know, it's just kind of like, oh, this is slightly uncomfortable. Like certain areas obviously hurt worse than others.
Totally.
But yeah, it is much, I would say honestly, like Botox is like nothing. It's almost like somebody's just like pinching you. Like it doesn't really hurt. And then yeah, from my experience as far as like the lips, like you're gonna get the numbing cream, and yeah, it's not great, but it doesn't
A
really,
good numbing cream goes a long way. It totally
yeah.
takes the edge off.
And it doesn't take that long. Like
No, it kicks in so fast. Like years ago, I used to do dental blocks a lot, but I really don't do it anymore because by the time I give you shots in your gums and your mouth and dental block you up, like we could be just done with the filler and then just like twice as many shots, and then your lips are dead for like 6 hours. And so now it's just really good. Topicals have come a long way. So it's really not bad. And I mean, I always say, I'm not going to lie to you, it doesn't feel good or anything, but it's quick. I mean, I can get your lips done in like less than 10 minutes and you're in and you're out, and there's no residual pain. Once it's done, it's done.
yes,
It can be like a
exactly.
little sore, but it's not a big deal.
100%. And then, so that was kind of all injectable questions. And then I did want to cover really quick, just to round it out, kind of like PRP or medical grade, you know, facials or treatments.
Yeah.
Like we had kind of talked about like IPL in the first one. So what are your thoughts on those? Like which ones are, obviously it's going to be individualized on the person, but which ones are more credible than others? And which ones are kind of like, those look cool, but maybe don't do that.
Yeah, that's the thing in this industry. There's a lot of smoke and mirrors out there. So you have to be careful with the treatments you choose. Just because there's hundreds of them now, and half of them, to be completely honest, like don't do shit, you know? So you have to pick the ones that are like tried and true and gold standard. So I say your top maintenance treatments, if I were to list like my top 4 things outside of injectables, I would say injectables honestly to me is like the biggest bang for your buck, because you know for sure with Botox and filler you're gonna get those instant results. You're gonna correct volumes and wrinkles. It's a win-win. But then moving on from there, I would say top treatments for skin would be IPL photofacial, which we talked about in the last one, microneedling with PRP, hydrofacials or any kind of like good medical grade facial, and then chemical peels. So those would all be awesome things. And for younger women or just really anyone just starting out, don't be overwhelmed like, oh my gosh, I need all these treatments like this week. It's a really slow process. So it's just like taking those treatments and just slowly starting to do them over time and just mix them in. There's really no perfect order either. It's not like you have to do this first or that first. It's like, if you just want to invest in your skin over the next year, try microneedling out, try and get a IPL photofacial, try a chemical peel. Just doing little things over time for your skin, you'll slowly start to work on it and you'll see what works really well for you, and you'll just start seeing those changes in the results. So a little bit of information about those to kind of break down what will be best for you. If you have a darker skin type, there's a Fitzpatrick scale. So depending on your ethnicity, if your skin is darker like Indian, African American and up, or even some Asian skin, you're not going to be a laser candidate. We don't want to laser your skin. It can cause issues with pigmentation. So you're going to be a great candidate for chemical peels. That's going to kind of replace the laser category for you. And those are things you can do. There's tons of different peels and they do different things. So if you're somebody who's suffering from acne, you're going to do a peel that's more geared for acne. If you are suffering from pigment, do like a phenol peel for pigment. And so chemical peels are, you would go in and see either an esthetician or a nurse, and they're going to put the peel on you, and typically you wear it home. Nothing really happens for the first 24 hours, and then all of a sudden your skin kind of like cracks and just starts peeling like a snake is shedding skin. So you do need a few days where you can allow for that dead skin to kind of just shed off. You don't want to pick at it. You just want to like let it do its thing. But there's definitely different varying depths of peel. So you would just talk to your provider like, okay, hey, this is my first time. I want to do just like a baby light peel, nothing crazy. Or you can do one where you're going to like totally shed sheets of skin for days, you know? So it just depends on what you're going for.
Yeah, I'm like, ooh, I don't know about that, but
I know.
I would be like, it would be so hard for me to not pick at it, which I know would be terrible.
It's so hard. And it depends on your skin too. Like it depends on your goals. Like if you're somebody who has some major pigment or acne issues going on, you might do like a series of a few peels in a row. Or if you're just somebody with good skin that just wants like an anti-aging treatment, like one peel a year is perfect. And then microneedling is really popular. People have heard it coined as the vampire facial. And that is a needling treatment. It sounds painful. It's actually not at all. Again, like we'll numb you with a topical numbing cream. And then we use, it's like a little oscillating pen, and there's little teeny tiny needles on the end of it that oscillate really quickly. It almost feels more on your face like a vibration than anything. And those little tiny needles are making their way into the dermal layer of the skin where your collagen lies. They injure the collagen, and then your body's response to that is to build the collagen back up bigger, better, stronger. So you're basically inducing a collagen boost with this treatment. And then on the surface, it really helps with just texture. So it's going to help. It's really great for people with acne scarring or just like really enlarged pores. It's going to just help tighten and smooth out the texture of skin. So that's something that you can do in a series, especially if you're trying, same thing applies to all these things. If you're tackling a skin issue, like if you've got some severe acne scarring, you're going to want to do like a series of 3 or 4 of these treatments back to back. If you're just throwing it in for anti-aging, just try it one time, you know? So when you're doing it for like scarring or texture, you're going to come in like once a month for like 4 months in a row. And then it's about a 24-hour turnaround time. So you get the needling done, and then right afterwards, it does induce a little bit of bleeding, and that's a good thing. It just shows us that we're in the right layer of the skin. That's all like wiped off. You can do it with or without PRP. So PRP is platelet-rich plasma, and that's where we're going to draw your blood. We spin it in a special tube that has an auger at the bottom, and we put it in this machine called a centrifuge, and it spins it super fast, and it actually separates out the platelet-rich plasma from the packed red blood cells. So when we pull it out of the machine, what was once a tube of red blood, now at the top of it, it's like a clear serum, and that actually came from your own blood. And so we infuse that serum during the needling, and that just induces, like, it's healthy for your skin cells. So I kind of describe it, it's like putting fertilizer on your grass and helping the grass grow healthy. It's doing that for your skin cells. So it's repairing skin cells, and it's for skin health and collagen. It also, I think, helps you heal a little faster when you do the PRP, because there are so many anti-inflammatory properties in our blood. I think it helps you heal just a little bit quicker too. But typically about a 24-hour turnaround time. So you're really red the day you get it done. You won't want to put anything on your skin. And then the next day, you're just a little bit pink, and you can get right back in makeup.
Yeah. So again, one of those things you probably don't want to do and then go to an event.
No.
So don't get your lips done, and don't get a PRP facial.
2 weeks. I would say give it yourself 2 weeks.
Yeah, for sure. But Botox right away like that, you can get it, go out, no issues. Obviously things settle over time and they look better, like Racquel said, but they just, you can immediately kind of go out with that.
Yeah.
So yeah, I think we covered really everything that I wanted to in that area. And I think this was so helpful for people because, like I said, I get a lot of questions about this, and it's a really scary, it's an amazing industry, but it's a very scary industry, especially when we're talking about injecting. We're not talking about like, oh, this acid wipe, you know what I mean? Like now we're talking about like serious stuff. So you really want to make sure that you're going to the right people, that you're starting small. You can always add more if you want, but just be really careful with it. But it is very safe, and nothing happens when you stop. It just kind of dissolves. So if you decide to do that, like that's also fine. But just kind of, start slow and really just go with the right people. So one more time, give your online consulting information for skincare. And then also, you are in St. Louis, but if people want to either go or travel, tell them where the office is.
Yeah, I'm in St. Louis, Missouri, and I also have a great network of injector friends all over the country, so I'd be happy to point you in the right direction. But you can check out more information about all of these things on my blog. I created my beauty blog a couple of years ago for just this reason, because they wanted like a safe place to learn about these things. So I have blogs on all of the treatments we just talked about if you want to dive in deeper. If you go to my website, it's racquelfrisella.com. I blog on all of the different treatments that are out there, what I think is best and whatnot. And then I also do virtual skin assessments. So if you're not in St. Louis and you just want help with medical grade skincare, I would be happy to help you with that. I do like a virtual skin assessment online, and then I can actually ship nationwide. And then for treatments, we're in St. Louis, and I do have patients that travel in from all over the country. I'm super grateful. And that's me.
Yeah, well, I appreciate it so much. If you guys have any other questions for me, you can always send an email at info@teamlocofit.com or go to our website, teamlocofit.com, and we will catch you guys next week. Thank you so much again, Racquel.
Thank you so much for having me. It was truly an honor. Love you.